Sometimes when people use the hip hook, they can experience a feeling like it's just flipping over their bone. And I want to explain a little bit more about what's happening there. When you lie on the hip hook, the tip of the hip hook will go to right inside the pelvic bone right here where the iliacus muscle and the psoas muscle live. Now, if you have a lot of tension in this muscle, which many of us do, especially when we first start using the hip hook, you can imagine these muscles being kind of tight. You know, like when your bicep is contracted, it gets bigger, right? So when a muscle is contracted, it takes up more space. So this iliacus muscle will be thicker. Sometimes it can be up to 4 times as thick when it's contracted. Same with the psoas. If it's holding tension, it's going to take up more space, which means that when you place the hip hook here, this crevice or this area here will be full of muscle, full of tight muscle. So if you took a line and you kind of drew it from the bone across, this whole area could be just filled with tight muscle, which means that when you first lie on that tip of the hip hook, that tip is very close and if to the edge of the bone. And if you push on the lever, let's see if I can figure out the right angle, but push on the lever to rotate it, and it's already all the way out here because the muscle is so tight, it's going to just plunk, flip outside of the bone. So when you start to use the lever, you might feel it like it's just popping out. So this is a sign that there's too much tension in the iliacus and the psoas. So the first thing that you need to do is really focus on just lying on the hip hook without using the lever to get some of that muscle tension to release. And you can do this in standing with the standing technique, or you can do this lying down. But making sure that you're just letting this kind of sink in to this muscle so that you are getting this to relax so that you can actually get that tip to go deeper, because the tip has to go deep enough in order for you to use the lever to put pressure on the iliacus muscle. In addition, if you are too close to the bone, so say you find the bone and you put the tip kind of right inside the bone here, and then you use the lever, it can also flip out. So sometimes it's just a matter of bringing that tip a little bit more towards the inside, you know, a couple centimeters to an inch in the inside, so that there is room for it to rotate and actually push on the iliacus. So try those tips and see how those work. Give it some more time to release some of that tightness and tension, and see if you can get that lever technique to work a little bit better.